Heather Binning's here now, founder of the Women's Rights Network, because a rather strange story came out yesterday in the Times. Mental health hospitals responsible for violent criminals have policies which allow biological male patients to self-identify as women, according to an audit recently published. Heather, a very good morning to you.
Good morning, Mike. Thank you for having me on.
No, not at all. Thanks for joining us. This is a weird story, isn't it? Because I read it through and thought, what would be the point of this? You know, if you've got mental health hospitals allowing violent criminals to sort of judge and decide who they want to be and self-identifying as women or cats or whatever it is, it doesn't make a lot of sense to me.
It doesn't make any common sense at all, does it? And
No.
That's why it's extraordinary that over the last few years, this idea that what is more important is how people feel and how they perceive themselves to be, and therefore be treated in the same way, is more important than the real rights and common sense of what is safe. I mean, we know the same thing has happened in prisons. It's happened across the NHS. Women, already vulnerable women, are put in even more vulnerable situations by allowing this to happen. Now, I know the FOIs that were done prior to the Supreme Court judgment, which had made it absolutely clear that when it comes to single-sex care, then sex is the dominant factor, and we need to take that into account. So, you know, I'm hopeful that very shortly we'll see revised policies coming out that put this squarely back in the land of make-believe, and common sense returns to everybody involved.
Well, you would like to think so, because I mean, it's bad enough to have single-sex wards which allow, say, for example, a trans woman, effectively a man, to be, you know, put in a bed there where they're surrounded by women. But when you're dealing with violent criminals, you know, who may indeed have, you know, malice aforethought about women and who may wish to attack women and who may even have a history of attacking women, if you're going to allow them access to women's wards, it's completely and utterly insane. I mean, I know we're talking about people with mental health problems, but this is an insane policy, isn't it?
Well, this is absolutely, but you know, it has happened everywhere. These insane policies have happened, and as I said, already vulnerable women.
Yeah.
We did a report 2 years ago about rapes and sexual assaults across the hospitals in the UK.
Yeah.
And we inquired the police of the reported crimes. There were 6,500 rapes and sexual assaults in a 3.5-year period. 2,000 of those were rapes. They took place on hospital premises, and that included mental health hospitals. You know, so there has been no further follow-up to see exactly where these have occurred. Are they staff? Are they patients? I fully expect, particularly in these mental health institutions, that a lot of staff will be very vulnerable to this practice happening. What we've since discovered, of course, is that the data collection across the NHS is completely skewed. We've done a report which is incoherent and unsafe, which shows that you cannot rely on the sex marker in the patient's records to give you the true biological result. And so staff are in a very difficult position. I know there was a woman, an instance quoted of a woman who complained about a male being on her ward. This is not a mental health hospital, I have to say, and this was denied by staff. Now, when the staff have got a record of a patient, and that record says that patient is female, are they, you know, they need to be able to rely on records in order to do their own job and to be safe themselves.
Right.
And we have followed this up from our report and further to the Supreme Court ruling. We've had good feedback from the government department to say that they are, you know, considering it and looking at it, and yes, it's not acceptable, and that's about the data records only. But as I say, the Supreme Court ruling for the NHS Trust to be saying, well, we're going to wait and see what further guidance says. The law was always this. This is not a new law. It always does. The Supreme Court has confirmed that this is the law, and these practices should immediately cease.
Right. Because it's unlawful, right? I mean, I said this at the time, because an awful lot of NHS trusts alone, out of all places in the public sector, seem to be very much sticking in the mud, as it were, and saying, well, we're not going to change our policies until we hear something different. Well, you have heard something different. As you say, it was always the law. It's now been sort of reinforced as the law, so they shouldn't be allowed to be able to break the law with impunity, should they?
They absolutely should not. These policies should be immediately withdrawn, and sanity returned. As I say, the data collection is one weak link that they have to address urgently in order that staff can do the job properly. But we trust hospitals to look after ourselves and to look after our loved ones. We trust mental health hospitals that they will also look after us. Some are in there for a varying extremes of mental health illness,
Right.
and of those in Broadmoor, that's quite terrifying that those prisoners, or who would affect be prisoners, or who are held in Broadmoor, are accommodated on a ward according to their choice.
It's amazing, isn't it? I mean, they talk about, different sort of situations where individuals may be acutely unwell, in which case they would prevent them from going onto a single-sex ward as somebody with a different gender. But, of course, that would suggest that when they're not acutely unwell, even though they're violent, crazed criminals, they'll be all right to go on there. I mean, it doesn't make any sense at all.
It doesn't make any sense. As I highlight, these are already vulnerable women, and this is adding to the vulnerability. That's the really, and it seems to be when these policies were produced, no thought at all was given to the women. The outcomes for women and how they might feel about this were not considered. It was purely the consideration given to the wants of a few men in society.
No, exactly right. Good to talk to you, Heather. Thanks very much indeed. We'll have to keep an eye on this story because we can't allow this kind of madness, which it really is, to go on.